Willow, thanks for joining us. Can you tell us a bit about this report?
So the report is the result of what the Chief Coroner calls an expert panel. 7 people he selected with expertise in areas of mental health, government administration, and First Nations communities. The panel looked at the cases of 12 young people who died between January of 2014 and July of 2017. All 12 of those young people had been in the care of a Children's Aid Society or Indigenous Children's Wellbeing Society. 5 of those deaths occurred within the first 6 months of 2017, which is what really prompted the coroner to start this review. 8 of those 12 young people were Indigenous, and 6 of them from Anishinaabe-Aski Nation territory, which of course covers a very large part of the province.
So what were some of the things that they found?
So the panel looked at things like the different service systems within child protection, where the young people had been placed, their family and community histories. Grand Chief Willow Fiddler of Anishinaabe-Aski Nation said the report confirms what they've known all along, and that's that the overall quality of care for children under protection is inadequate and failing them. All 12 young people whose cases were reviewed had mental health challenges, so histories of self-harming behaviors and suicide attempts. The report said that these young people were often in crisis modes until the next crisis occurred, and ensuring their safety and providing intervention often meant simply making sure they had a bed to sleep in and a one-to-one worker present. This was a pattern that continued over and over again in these cases. Grand Chief Fiddler also said the most troubling thing that he found in the report was the lack of tracking mechanisms. So there was no communication between agencies and workers when these children were transferred between homes and placements. The panel also discovered that these young people were placed on in an average of 12 different homes before they died.
What do the families of these young people have to say about the report?
So we know that the 2 of the cases that were reviewed were Kanina Sioux Turtle. She was 15 years old. When she died, she was placed in a foster home under the care of Tikanagan Child and Family Services in Sioux Lookout, and she had a history of suicide attempts that were known to Tikanagan, yet she was left alone for 45 minutes. When she died, Amy Owens is a 13-year-old young girl who also died by suicide in a residential program in Eastern Ontario. She was to be placed in under 24-hour supervision, but there were no spaces or room for her for that. The parents of Amy and Kanina are both frustrated that the report didn't give them the answers that they were hoping for. Kanina's mom, Barbara, has repeatedly asked Tikanagan why her daughter was left alone for 45 minutes when she died, and she's still waiting for an answer for that.
And Willow, what now comes of this report?
Grand Chief Willow Fiddler is going to be calling on the ministers responsible to form a task force or committee to implement the recommendations. He also said that the NAN chiefs will be meeting in Assembly in November, at which time he expects to receive some direction from them in response to this report. He said that could mean a transformation act similar to the one that they're doing for health in NAN right now.
Important report, Willow. Appreciate you taking some time to speak with us about it today.
Thanks.